time here. So thank you everybody for joining us. My name is Jennifer Meyer. I'm a program specialist with the Department of Human Services in Kern County. I work here in child welfare. I'm in our assistant director's office. And so my role here is to work on a lot of the state initiatives. So I oversaw our implementation of FFPSA with our comprehensive prevention plan. I work on our child welfare system improvement plan, and a variety of other initiatives. And so I'll be kind of leading the presentation and kind of introducing our various partners as we go along with the presentation today. Let me go ahead and share my screen and get the PowerPoint up. Give me 1 second. Can everyone see that? All right, thank you. So again, I'm going to be kind of walking us through the presentation today, and I'll be introducing our partners as we go along and they do their section. I just want to start off by kind of sharing a little bit about how we approached FFPSA in Kern County and our comprehensive prevention plan. When I came over to this office, the FFPSA was already in progress to some extent. And initially, I think that in Kern County, we didn't have a lot of evidence-based programs, especially not the ones that were already listed, that we were looking at those famous 10 evidence-based practices. And so we had a lot of focus on that initially. A lot of our concern was, how are we going to implement this, and how are we going to implement this countywide? If you're familiar at all with Kern County, you may recognize some of our concern goes to how large our county is. Sorry, I just realized my video wasn't on. How large our county is, how spread out our county is. And while we have the majority of our population here in Bakersfield, we have pretty significant populations in towns that are 2 hours away from here. So within one county, you could drive for 3 hours to get end to end. And how do you serve a population and really, really significantly different needs across a county that large? So initially we were looking at that and we had a lot of concerns about how do we do that. So what we did is we held 2 convenings here in Kern County to work with our partnering agencies to ask them how they thought we should approach this. So we realized by the second convening, we don't really have a lot of support in our primary and secondary prevention. We recognized that our plan had gaps in it. And I can share for those of you that may have been involved, the Linkages Convention, not last year, but the year prior in 2022, that really kind of sparked a lot of ideas of how do we partner in a different way, using that kind of mindset of prevention and shifting from just focus on that evidence-based practice to really focusing on the primary and secondary types of services, then in some cases also are tertiary for a lot of our clients. So we started developing out from there. During that convening, the first presenters I'm going to be moving to next, it became very clear to us that when we are discussing how do we help the families in their community with their most basic of needs to give them support to really prevent them from getting more involved, the response from everybody in the room was, we have that. They're called family resource centers. We have them in every single part of our county. How do we support them in a more meaningful way? And so that kind of began a lot of this journey of looking at different ways that we would be partnering. So we used some of our funding to start that process, and we are excited that given the governor's budget, hopefully some of that funding will be continuing for a longer period of time so that we can continue supporting our partnerships and really making a more impactful difference in primary and secondary prevention. So this presentation represents some of those partnerships and the incredible programs we have here in Kern County. So I'm going to be handing this off to our first partnering agency, which is First 5 Kern. Today joining us, we have the Executive Director, Amy Travis, and the Evaluation and Impact Manager, Lindsay Call.
Thank you, Jennifer. I'll start off with the presentation and then hand it over to my colleague, Lindsay. I'm Amy Travis with First 5 Kern. And a great introduction. It reminded me of, all of the meetings and the community input that you guys gathered to come to this consensus of partnering with us. And, one of the things that we also try to do is serve the entire county, as the Department of Human Services does, and that challenge with the geographical expanse across our county is something that we are trying to also, resolve and look at as far as how do we serve everybody in this large county. So I'm going to first start off with sharing a little bit about what First 5 Kern is. It looks like there's some local agencies on the line. I'm excited to see some friendly names. Oh, Robert, it looks like you're not muted. But I'm going to briefly talk a little bit about First 5. You may already know what it is, but that's how we designed our presentation today. Am I in charge of the slides? Sorry.
I have it.
You do? Okay, we can go to the next one. So a little bit about First 5. Our mission is to enrich the lives of children ages prenatal to 5 through investments and community partnerships, as in this one, in child health and development, resilient families, and quality early learning. Our agency is established through Proposition 10, which is tax allocated through the sales of tobacco products for the use of early childhood programs for children ages 0 to 5, so prenatal to 5. And each of California's 58 counties has a First 5 agency. So if you're not familiar with your own county, there is one in each of the California's 58 counties. And the Proposition 10 funding does come to us in the manner of the county size. So the number of births contribute to the allocation that each county receives. But the funds are able to be leveraged to support initiatives with local agencies like this one and several others that we've been able to really just partner on. And the fact that the Proposition 10 funds do support most of our staffing already, we're just able to leverage that and see how we can, again, compile and partner on making, good use of all of our county resources. And so we really feel like this one that we're going to share with you was a perfect example of that. Go ahead to the next slide. So we have 4 focus areas. These are actually also the 4 focus areas that the state has required that all counties work within. Now, the way that we work within the 4 is up to each county. So there's a variety of different programs throughout the state, but the focus areas are all general and the same. And those are child health and development, resilient families, quality early learning, and then strong systems. And that's within our ordinance through the state. And like I said, each county is able to work within those focus areas to fit the needs of their community. Next slide. So in Kern, we have funded over 100 different programs over the last 25 years, 66 different agencies, but we're currently funding 39 programs. And this infographic is kind of small, but it does show that the 39 different programs that we are funding. Majority of those are family resource centers. So we fund 16 different family resource centers currently, but we also have programs in early education, swimming programs, domestic violence programs, child welfare programs, health and wellness. We have an immunization clinic, dental health network, developmental screenings, and we support children with special needs. So again, with 39 programs, we really try to reach as many children as we can. And the Family Resource Centers are what we're going to talk about today. And but before we get into, what exactly that partnership looked like, I wanted to just kind of walk you through a family that receives services and what it looks like for a family to be supported through what we call FRCs for short, Family Resource Centers. So go to the next slide. Now, Family Resource Centers are typically community-based or school-based. So we have both here in our community, and they provide a variety of support services, parenting classes, counseling, educational resources, and assistance for basic needs. But this is where we really identified the partnership, because FRCs are often prevention and early intervention strategies. And this was something that the Department of Human Services here and ourselves agreed on and developed a partnership. So Maria and her 2 children moved to a new community, and we're going to just kind of walk through. I wanted to paint a picture for you of a family that receives services, so you can get an idea of the comprehensive prevention strategy. So Maria moved with her 2 children, and she's facing various challenges, which include finding stable housing, accessing educational resources, and just managing the overall stress of the transition. Go to the next slide. So Maria reaches out to her local FRC, and here's some of the services that she was able to receive through this, what we call one-stop shop. She was actually able to find housing assistance. The FRC was able to connect Maria with the affordable housing programs in the community, and they provided her with assistance with rental applications and guidance on navigating the housing market. She received educational support. So Maria was concerned about her children's education, and they were able to provide her information about the local school, the after-school program, and the tutoring services that were available right there in her community. Maria attended the parenting workshops at the FRC and learned effective strategies to reduce and manage her stress. And she also met friends in the community and the community networking opportunities that were available to her. And then she received access to her basic needs. And through that, receiving those basic needs, Maria was able to focus on building a stable and nurturing home for her sons. So through all of this, Maria was able to navigate the challenges of her new life in the community and become more effectively. As you can see, this graphic just shows that the Family Resource Center was the center of all the resources that she was able to provide. She may have not, the Family Resource Center may have not been the one actually providing the services, but they were definitely able to link her to what she needed for her individual needs. So that is the quick introduction to FRCs and then First 5 Kern in general. And if there's not any questions, I'd like to pass it on to my colleague, Lindsay Larson-Call, and she's going to go through in depth the partnership that Jennifer was speaking about with our local Department of Human Services. But I'll just open it up for questions if there is any. Okay, I don't see any. Thank you. And Lindsay, take it away.
Thanks. So I am one of the newest members of the First 5 Kern team and came just over from running a family resource center. So this was exciting for this to be one of my first projects working on at First 5 Kern. The overarching goal of the partnership was to increase access and support for court-mandated parenting classes. And from that overarching goal, we came up with 3 objectives. The first being parents should have unhindered access to countywide court-mandated parenting classes. And the countywide was really key because, as Jennifer and Amy both mentioned, we're a huge county. So it's very hard to achieve that countywide access. The second was that families must recognize and navigate and utilize available community resources. And the third was to connect children to essential developmental screenings, community resources to enhance their language acquisition and school readiness. So next slide. So with that goal, we came up with a three-pronged approach. And this was this wasn't necessarily we kind of had one idea going into it, but it kind of evolved as we went along. So our first main idea was to have mini grants to establish family resource centers. So we reached out to not only the 16 family resource centers that First Five Kern funds, but also a couple of additional ones that are acting in our county to offer mini grants. And so for those family resource centers that offered court mandated parenting in-house, they were eligible for up to $10,000 mini grant. For those family resource centers that didn't offer court mandated parenting in-house, but could provide other supports to families, they were eligible for $8,750 mini grants. And then from there, the second thing that kind of developed and emerged was mini grants to developing family resource centers and community schools partners. So probably a lot of your counties are doing this, but in Kern County, a lot of school districts are getting community schools funds. And our Kern County Superintendent of Schools, in surveying those community schools grantees, found that one of the high priorities was to either strengthen or develop a family resource center. And so we thought this was a great opportunity to both provide these mini grants to help them provide some direct supports to families, but also pair it with an information session that would help them in the development of their FRC. And so we have a panel of 4 school-based family resource center coordinators that are going to be sharing their experiences in developing and strengthening their FRCs. And we're also going to have a focus in that session, which is actually a week from today. We're going to have a focus on how can these FRCs support parents that have court requirements, that need court mandated education, whether that's providing a private space in their center for them to do those on Zoom, or it's providing transportation assistance. So we're going to have a focus on how can they help support court mandated education and requirements. And then the third was to increase court mandated class access through a training of trainers and training new community agencies. So it just so happened that when we were developing this, we were also being contacted by some other community agencies that wanted to begin providing court mandated training. And so we thought this was a great opportunity, again, with that countywide focus, to increase the number of options that parents had for getting those court mandated classes. So next slide. We had 2 guiding principles as we went through this. So the first is geographic diversity to meet families where they are. So you can see those red pins around the county are places that provide in-house court mandated parenting classes. And 2 of those, with a third on the way, provide Zoom sessions as well. So that we were trying to also connect those blue pins that are other established family resource centers that don't have court mandated classes, to make sure that they knew how to connect their parents to those family resource centers that were offering Zoom options, for example, to help their families know how to access those classes. And then finally, those yellow pins are the developing family resource centers, the places that we try to engage some outlying areas that haven't had as much of these services and try to help support the development of local family resource centers for them. Next slide. The second guiding principle was to give local discretion to meet family needs. So we really had a long list of eligible services that the Department of Human Services and First Five Kern agreed on would be eligible for those kind of supportive services. And we allowed the agencies to select based on both their capacity and their strengths as an agency, as well as the family needs that they were seeing and the requests from their community. By far, the biggest category was concrete supports, grocery gift cards, food, diapers, clothing and winter coats, depending on the climate that they were in. Transportation was a close second. Gas cards, obviously with gas prices right now and the distances in our county, gas cards and bus tickets were huge, car seats to help people get to their appointments. But several other areas as well, a lot of household supplies. You can see even high chairs, cribs, strollers, those were specifically at one of the family resource centers that serves former or current foster youth who are becoming parents. And those are really important pieces of them welcoming a baby into the family, making sure they have the basic supplies that they needed. Educational materials, educational sessions, healthy development were included, increased developmental screenings. And we also loved the FRCs that thought kind of this was a time limited opportunity, but what would benefit their community long term. So one actually requested to purchase a medical grade freezer and fridge. They already had at their school-based FRC a nurse on staff, but they weren't able to give local immunizations effectively because they didn't have this equipment. And so this is something that they'll be able to use well past this period to continue to provide those supports locally. Next slide. And so finally, just to kind of wrap up, thinking about all the ways that we were trying to reduce the barriers to court mandated classes. So one of the conditions of receiving the mini grant funding was that the agencies would make their court mandated parenting classes free if they weren't already. And so they were able to eliminate fees using this funding. They were also, it subsidized the required AAPI assessments so that they could continue to offer reduced rate classes beyond this period. Some of the agencies expanded evening class options. They weren't typically able to do that because of staffing and funding challenges, but obviously that was in a lot of demand in some areas. Providing meals and snacks to help get families there, participation incentives. Many of them used it to provide childcare during those classes so that parents could come and have a safe place for their child to go while they did that. And of course, the gas cards and bus tickets were really important for both getting to the classes and court dates and things like that. And then finally, we worked with some to enhance their promotion of their classes, making sure to spread the word a little bit, help them bring that to a little bit more awareness of the fact that they were offering court mandated classes, that they were offering Zoom in some instances. So those were some of the ways that we were really working on reducing those barriers to the court mandated classes. So yeah, next slide. That kind of wraps up. But again, like Amy said, if you have questions for this project and what we were working on with DHS, we're happy to field those.
Thank you both. We have a few minutes built into the end. Hopefully, if there are questions, we can move back to that or questions as we go along. We're going to move on to our next presenter. Today, we have the Assistant Director of Public Health for Kern County, Amy Rutledge, and she is going to share more information about the Black Infant Maternal Health Initiative.
Good afternoon. So in February of 2021, a discussion between Kern County Public Health and our previous presenter, First 5 Kern, was had regarding the status of our Black infant and maternal mortality rates here in Kern County. By the end of the conversation, it was decided that a community effort was needed to change these statistics that we have here. And by July of 2021, 19 different organizations representing government, community-based organizations, healthcare industry, and community members were invited to participate. And over the next year, this group met monthly and came up with a 3-year strategic plan and formed the Black Infant and Maternal Health Initiative, which we affectionately call BIMHI, and I will refer to as BIMHI throughout the rest of this presentation. And in June of 2022, our local Board of Supervisors formally adopted BIMHI's strategic plan. As part of this strategic plan, we developed 3 goals and 9 objectives. In summary, those goals can be described as follows: increase African-American Black healthcare workers in Kern County, address mental health as a factor for African-American Black infant and maternal mortality by hosting focus groups and sister circles while implementing a 3-year public awareness campaign, and increasing provider awareness of African-American Black infant and maternal health disparities through attendance at presentations and trainings. Next slide, please. And so next slide. Got ahead of myself. So as part of that, what we're really looking at is the data and the statistics and what we're sharing here. So I'd like to start by just presenting a little bit of that. So what you see here are the statistics for Black infant and maternal mortality in Kern County. This one is pregnancy-related deaths per 100,000 live births. And as you'll see from this chart, we have those by race and age, and the inequities increase not only with age, for Black women older than 30, being 4 to 5 times more likely than their counterparts to see those health disparities. Next slide, please. Here we have the maternal mortality rates for the last 5 years. And what we see here, maternal mortality is defined as the death of a woman while pregnant or within 42 days of termination of pregnancy. I actually believe that has recently changed, that termination date. But as you see from these charts, Black women are shown to be dying at 4 to 5 times the rate of any other race. And research shows that Black women continue to experience significantly higher rates of maternal-related deaths, even when they are pregnant at an optimal age, have a high income, or are well educated. In addition, the U.S. has one of the highest maternal mortality rates when compared to other high-income industrialized countries. Next slide, please. As we review the data, I ask you to keep in mind that for the purposes of this slide, the Black African-American women and infants will be represented by the red colored bar. It's a little bit hard to see, I know, between the red and the orange. As you can see, preterm and low birth rate usually go hand in hand. A preterm birth is defined by the CDC as when a baby is born before 37 weeks of pregnancy. Low birth rate is defined as a weight of less than 2,500 grams, which is about 5.5 pounds. And as you can see from this chart, a higher percentage of Black infants are born preterm or underweight when compared to other races. Research shows that being born early or small means infants may suffer from underdeveloped organs, breathing problems, be more at risk of infections, and other serious ailments that affect their health. Next slide, please. Infant mortality, which is defined as the death of an infant before it reaches the age of 1. And here you can see that Black infants are dying at a rate of 1.5 times the rate of every race except American Indians and Alaskan Natives. And what we're doing through this partnership with DHS is this funding that they've provided us will allow us to share this information with our community in furtherance of achieving our goals as BIMHI. And we're going to do so by sharing this information via various media outlets such as television, radio, and social media, as well as additional outlets which are utilized by our target population. It is our hope that by providing this information, we will better educate the community on the health disparities faced by our Black infants and mothers, allowing for an honest discussion to take place between Black mothers and their providers, as well as the community at large. In addition, we hope to start the conversation with our community on what services are available currently to our Black mothers and infants, as well as help facilitate more discussion on what services they feel are needed, all in an effort to turn these statistics around. We know these changes will need to take place over time, but this funding has allowed us to take the first step in our mission to bring equity to our Black community by uniting and empowering birthing parents and physicians. And if you'd like more information, please visit our website at www.kernbimhi.com. Next slide, please. And as you can see, these are a list of our partner agencies. As I mentioned already, we work closely with First 5, as well as our Department of Human Services, as well as a number of local other government organizations and hospitals and nonprofit organizations, all of which have helped us to get this information out in our community and to our providers with the goal of educating so that they understand that their practices, of the health outcome of not just the birthing mothers that they're serving, but also their infants.
Thank you so much, Amy. Like I said, we will have some time at the end to be able to open it up to any questions about any of these programs or initiatives. We're going to go ahead and move to our next presenters. This is the team from the Bakersfield American Indian Health Project. We have Mr. Angel Galvez. He's their Chief Executive Officer. Evelyn Eterno, our LCSW, who is the Director of Clinical Services, and Pamela Herring, who is the Family Advocate with Behavioral Health Services.
Thank you. Thank you so much. It's really good to be here with you all. And I really, truly appreciate the prior two presentations because I think it sort of kind of will segue really well with our presentation and the conversation of the services we provide. You'll be hearing more from Ms. Pam, our family advocate, and Ms. Evelyn Eternal on the next slides, but I just wanted to really take this time to offer a little context and just some background in our organization and also provide you sort of kind of the census and who we provide these services to. Bakersfield American Indian Health has existed since 1997. And in 1997, it started as a very small micro health outreach and referral program, if you will, for the Native Americans that resided predominantly in the city of Bakersfield and some of the outlining cities and towns. I've been with Bakersfield American Indian Health as their CEO for the last 4 years. And in these 4 years, we've really taken the mission of Bakersfield American Indian Health to become more than just sort of a family resource center to the Native American population in the county of Kern. And so one of our missions with the board of directors and I was to really focus the health center more as a health center for all Native Americans who reside in Kern County, because for two reasons. One, the Bakersfield American Indian Health Center is, or project is a health center that provides health services, and it's the only health center that provides services for the American Indian Alaska Native people who reside here in the county of Kern. You have about 22,000 Native Americans that reside here in the county of Kern. Of those 22,000, you have about 4 to 5 different Native Americans who are indigenous to Kern County. For example, the Tejon Indian tribe, who is the only federally recognized tribe, is a tribal entity that is ancestral to these lands. Others who are non-federally recognized are like the Tubatalabo tribe. They are up in Kern Valley. And for example, our Shalone Indian tribe, who is here in the local Bakersfield area. And that's just to name a few. Part of what we do, and really the focus of this presentation, is really to focus more on prevention services that we're offering for our contractual agreement with our partners and our Kern County Human Services partners, and that is to collaborate on prevention for providing services to children and their parents. We in the past have really not had that population of focus, just because our funding that we received from Indian Health Services really was for the purpose of providing basic medical care, if you will, for our population. And yes, although that may include children, it wasn't specific to anything other than just dental care, eye care, and other medical basic care for those individuals. So I want you to really kind of hold that thought as we sort of kind of present to you really the lens from which we feel we're navigating prevention in terms of traditions and culture. And so with that, if we can turn into the next slide. So with that, I just want to cover these learning objectives, and then I'm going to turn it over to, I think, Ms. Pam, if not Ms. Evelyn. And what we propose to accomplish here with this short, brief conversation is really to share with you how we've been able to partner to prevent with our partners and focus some of these services more strategically to serve our population in terms of those kiddos, either avoiding entering the foster care system or avoiding or keeping reunification, avoiding children being separated from their parents. You know, the focus at first was just to establish a family advocate who can really advocate for some of our Native American children who are entering the system, because many of our Native American people who reside in the county of Kern typically don't live, or I shouldn't say typically don't live. I should say they represent other Native American tribes from outside of the county or outside of the state. And so many of those children we felt would benefit by having a family advocate who can really represent their voice and present themselves during a legal or non-legal court mandated appointment experience. And so that's the hope today, is to really just kind of hone in and give you a little bit of what that includes. As you can see here in the bullets, some of which we feel we're very proud is really the championing the health, equity, equality, and the social justice through the lens of tradition and culture. And so in our slides, we'll be able to demonstrate a little bit of that. So with that, I'm going to turn it over to Ms. Pam or Ms. Evelyn, whoever wishes to go first, and we'll just go to the next slide. Well, I think I kind of covered that a little bit. I guess that was a little bit of my part as well. If you don't mind, Jennifer, we'll switch over to the next slide.
Oh, that's perfect. Okay. That's Pam. Okay, I guess then it is my turn. I've actually been with the Bakersfield American Youth Health Project now for going on 7 months. My main purpose for being family advocate is to, as you can see our slide, protectors of our young feathers. And this is a program that came out of the Kern County Human Services Department contract that we have with them to provide the advocacy to Indian children entering or in our foster care already. With that, I mean, I don't have anything to read or to mention. I'm just going to go from my heart. This program to me is very hands-on. I go when the Department of Human Services sends us a referral. What I do is that referral first is I look at the referral. It has the parent's name on there. It gives me all the initial information, kind of tells me what the family has been going through as far as what they have to go through for the courts, if the families are already in the court system, if the kids are already in the foster care system. The first thing that I do is I get in contact with their social worker to see if there's any other information that she can give me before I talk to the parents themselves. Then when I actually talk to the parents themselves, I kind of get an idea of where they're at, whether their kids are still with them or whether their kids are in the process of going to foster care, whether their kids are already in foster care, and how we can help them and what their court dates are. The one thing that I think about this program that is so relevant now is the fact that I can go into the court system with these parents and I can let these Native parents, let these Native parents know that they have support from our Native community and from other aspects of our community also. And the thing that makes it really good is it also makes the courts aware that these Native families do have other services that can provide for them in the families that they have. So I go to court, we sit there and listen to what's going on. When we're done with court, we talk to the attorneys. I'm in the presence of the attorneys when the attorneys are talking with the families. And the main thrust of this is to make sure that those kids, those Native kids, if they need to have Native families, if the families need to be hooked in with ICWA at all, the Indian Child Welfare Act, that is something that the courts look very highly on with our Native families, is to make sure that they have the support that they need to make sure that the children keep their Native heritage. Because I know a long time ago, our kids were taken out of all that and they lost it. So our main purpose, I think, is to make sure that our families that are in our foster care system, especially our Native kids, keep their Native entity. We can, if the foster care families don't have Native, that we can certainly help them get that. It's a very good program for me to be able to let our families know that we're here for them. And, that's what we're for. We have a lot of different services here at BIHP. And as I was listening to the other ones, I heard a couple other services that I think would be very well for our families also. But it's just, and it's very hard for me right now to talk because I'm looking at a screen, I don't see any faces or anything going on out there. but I'm blessed because this is what I get to help my families with. So I don't.
Several of us have worked with Native American children, and you can see on our picture here, Riley Rose is in the drumming group. He's the one in the red shirt, and he was also raised in foster care. So now he's coming back and teaching drumming and spirituality and just a little bit of everything. He gets the children on the drums, talks about the importance of drumming and taking care of each other in the system. So he's a big part of what we do, along with some of our other services, and we'll cover those a little bit later. Your turn.
Does anybody have any questions in regards to that aspect? Because I know this is fairly new for Department of Human Services and for BIHP. This is something that's come about, in the working at the tables, and I'm really very, very proud to say that I am the family advocate here and that can help these families with what they need. So please, if you have any questions at all, don't hesitate to reach out or whatever you need to help with.
Or you can put them in the chat and we'll try to get to those as well.
Yeah, no, not a problem, Pam. I think they're gonna save the questions for the end of the presentation, but certainly we could move into the next slide, and as they come in, we can try and answer those.
And Angel, do you mind if I jump in and just kind of share a little bit of
Sure.
real life, how this impacts our families? So right away after this contract started, we had, and obviously I'm not going to go into too much detail with confidentiality, but we had a family who came to our attention here in child welfare, and the child was on track to be in foster care and to enter family reunification services. But with the support that this family was given so quickly and so fully, they were able to make arrangements to really kind of address their needs immediately. And rather than having this be a child who was going into foster care, we were able to work with the family, with this support, and with the courts to recommend family maintenance at immediately. So that child was able to go home because these supports were being put into place. And I think what was mentioned earlier is that Kern County is a little bit unique in that way, that we do have our one federally recognized tribe that's a little bit more recent in that recognition. But the majority of our kiddos that come in that we do the background and we find they qualify under ICWA, they're not from a tribe that's local. And so we're so lucky to have this agency that any tribe, no matter what their background is, if it's federally recognized or not, that these services are in place to support them. So I just wanted to jump in and say that and kind of brag a little bit about this one. And
I appreciate that.
slide.
Yeah, no, I appreciate that. I think that's very, very important that we highlight some of the successes, because this is true. This is very recent work that we've embarked together. But just in that short period of time, we have seen the success of really having something in place where the justice system, if you will, and the social services and everything that is meant there to really help these children and help these families. Now with us being in the picture for those specifically who are identifying as Native American, they too have also this service that they can count on. And, it's very unique in the sense, sometimes, in some spaces, one might ask, well, why should, the American Indian, Alaska Native, or the Native Americans in general have these carve outs of these types of services? Well, it was very, very specific to federally recognized tribes. And unfortunately, many of the children that enter the system, if they're not from the local county federally recognized tribe, it doesn't mean that they cannot get some form of services. It just means that it is sometimes often difficult because, some tribes may lack or may have limited resources to extend to something like that, right? So I do want to point out that as for us here in the county of Kern, we do have a great relationship with the Tejon Indian tribe, and we have a very we foster a very great relationship, and so we work together also with our local county tribes like the Yokut tribe, Tule River Indian Health, who's located in the county of Tulare. So I just wanted to point that out, that I think we just offer, because of the plethora of other resources we offer. And, you know, one of the differences with what you mentioned, Jennifer, was that a lot of the children that come as a referral to us is that we do have the ability to deploy, if you will, tangible services such as housing. For example, there was a scenario, not a scenario, there was a family who we helped, and I'm not going to steal Pam's thunder because I think she's going to probably share a little more about that, but just following the same lines of what you just mentioned, you know, a different family who was also referred to us with a notification that this family was living in their car, and this is 2 adults with 3 children, all children under the age of 4. And we were immediately able to secure safe housing, show up to court, and I'll kind of stop there and turn it over back to Pam so that she can cover a little bit of, you know, a little bit of what's happening here in this image, but also, you know, just to expand a little bit more on that scenario as well. Pam, back to you, or can you guys hear me?
About the family.
Oh, okay, go ahead.
So anyway, so it was actually when I had gotten the information from Department of Human Services about this family, I was still fairly new, still wasn't really sure what was going on. So I went into the courtroom, and the thing that was really neat about it is the family was there. The kids were already in foster. The judge had asked me if I could come up to the front of the room and speak, and I, you know, said sure. So I went up to the front of the room, you know, got sworn in, and the first thing she asked me was who I was, and I introduced myself as Pamela Herring, the family advocate for Bakersfield American Indian Health Project. And she said, "Why are you here?" And I said, "I am here as representation for the Native American community and their kids for this family. I'm here to make sure that you know that this family has support for everything that they need and anything that they may have in the future. We, as Bakersfield American Indian Health Project and as a family advocate, are going to be here to support them." And not each one of them, but a couple of the attorneys asked, "Well, does that mean that, you know, you're going to give them what they need?" I said, we're going to provide for them what their family needs to survive and to support them for self-sufficiency. Yes, we will. So at that point, they decided to go ahead and give them their kids back that day. So that afternoon, we had them in the hotel, and the kids were brought back to them in the hotel. And we've been following them ever since. And so that to me is a wonderful thing to talk about. But one other thing I needed to say is, not only through DHS do we get these families. And the reason I wanted to say that was because when I was at court, I had ran into a young gentleman that I had known prior and had asked him why he was here. And he said, "I'm here because they're taking my son away." And I said, you know, and we had a conversation, and he said, and I told him what I did now. And he said, "Can you help me?" And I said, "Please come down to Bakersfield American Health Project, register, let's get you in here, let's see what we can do." And now that's what I'm doing with him, is I'm following him through his situations with court. And now the courts know that he does have substantial services from us, and that we are providing for him and his family. His son is still in foster care, but it looks pretty good. So it's not just from DHS, which is a wonderful, wonderful avenue, you know, for us to get these families. But sometimes when you're on the street, or sometimes when I'm talking to even the people that here in our office, you know, our clients that we have here, sometimes you run into that, and then you're able to, you know, help them in that way too, and tell them about the program that we have, and then we can that way.
There's an important stat on this slide that I want all of you to really recognize. And I want to contribute that to what Pam is mentioning, and really much of this presentation is focused around really helping these families achieve wellness and a journey of resiliency. And so, last year in 2023, we had 0 deaths by suicide among our American Indian, Alaska Native people. More specifically, we know that youth are more likely to end their lives in Native country. And so we celebrate that. We celebrate that because of these types of funding opportunities, if you will, or contractual agreements. And that story of this specific family who was homeless, who was living with children, who Pam went to court with, and we kept them, unified. It really leaves our American Indian, Alaska Native people with hope. And when you're at that level, living in a car with 3 children, and and you're struggling through life, many of you do the similar work we do, servicing all these different types of ethnicities and races and the population of focus. So we celebrate with you. We accredit that statistic to the work that you are invested in and the partnerships that you've created with us. Next slide, please.
Okay, some of what our program offers are in-home and on-site medical and behavioral health services. We are open 5 days a week, and we're looking to extend our services to East Kern as well, Kern, River Valley. We look at all of our services we put through a culturally appropriate lens. So we do include community-defined holistic healthcare services. We use drumming, regalia making, that is Native clothing, beading, talking circles, cultural groups, sweat lodges. We have a variety of services that we offer. And we do have clients that need transportation, so we will provide transportation to and from medical, dental, vision, and to our office as well for other services. And Pam talked about family resources, where we have cultural and traditional support services, our foster care parent enrollment. We're working on that. We will be recruiting for Native American foster care parents to work with our ICWA program, and cultural competency classes as well for staff and other natives to become familiar with other tribes and their practices. So next slide, please. And Sabrina Heinze is here, and she's going to take over a couple slides for us as well. She is an LCSW with our agency.
So thank you for the invitation to join today. I've appreciated the information that's been provided so far. Let me see if I can add to that. So I'm here as an LCSW, licensed clinical social worker, to provide services for adults as well as those children that we've been talking about. That is going to be a lot of my focus. We have designated substance use disorder counselors as well. And one of them does the talking circle. She is actually American Indian as well. There's group counseling with that talking circle, pathways to therapy. There's the elders, the veterans, the women, and the Two-Spirit. And with classes that we provide or that we're looking to provide are parenting skills, social skills, independent living skills, housing, and school-based supports, to being able to support and sustain our youth in getting back on track, getting the help that they need. For the counseling services, we have individual, we have groups, families, couples. We deal with depression, anxiety, trauma-informed care, domestic violence issues, anger management issues, grief and loss, and parenting and mentorship as well. And then we're looking forward to the substance use disorder residential and treatment outreach, referrals, placements, everything that entails. And listed at the bottom of this slide is where to send referrals to our program. That's referrals@bakersfieldaihp.org.
Next slide, please. Came up already.
So some of the supported services that our folks are eligible for include, but are not limited to help for the homeless. That's temporary emergency housing and rent utility assistance. There is a need for this, and I'm grateful that we provide this as an agency. There's medical direct pay services for dental, optometry, medication, labs, physician referrals, and specialty care. So we have a way to help with payment on some of these. The transportation, and this is a short list, it's to and from our clinic here for medical appointments, dental appointments, picking up medications, the pharmacy, the optometry, behavioral health, housing appointments, court, after-school programs, social services. So transportation, like I said, this is a short list, but we do provide that for our clientele. And then we have general assistance, and that's where we help those that are applying for CalFresh and Covered California benefits, submissions for job applications, resume development, tutoring, anything that a client needs to become sustainable again.
We also have a computer lab here to make it easier for our clients to apply for those public assistance programs and job applications, resume. We help them with everything here. Next slide, please.
That's it.
So our values, two of them stand out for us. Number two is we plan and build for longevity. We want to be around here to serve our Native American population forever. And number six, we value culture, language, identity, equity, and equity for all people, all natives, Alaska Natives, and Indigenous people as well. And as we're moving forward with enhanced care management, we'll be able to provide services to those that are non-native or non-Alaska Natives as well. Our philosophy is we will never leave any of our patients feeling lost, and we will do whatever it takes to help achieve healing. Angel, I'm gonna let you say that.
Thank you, guys. Appreciate everything.
Thank
guys
you.
do.
Thank you all for the presentation. We're going to move into our last presenter, and this is Assistant Program Director Jeffrey Oxford here with the Department of Human Services, who oversees our Housing Support Unit, and I will hand it off to him now.
Thank you so much, Jennifer, and thank you so much, everybody, for this wonderful opportunity to talk to you about our housing support unit that we've established here at the Department of Human Services. And hopefully I can share what we've been doing here in the lens of prevention services. So we can go to the next slide. So before I get started into what services we're providing here under our new housing support unit, I kind of want to give you a little bit of a backstory as to why did we have this need. So prior to our housing support unit, all of our housing resources that are available here through the Department of Human Services were individually siloed through their programs. And where this caused some issues was the only folks who knew about those programs were the workers in those programs. So anybody outside weren't really familiar with them. So for example, if we had some child welfare staff who were not familiar with some of our other mainstream benefits, they would not know about the CalWorks programs. Well, in CalWorks, we have, various programs available. There are some housing programs for them, but that child welfare staff did not know about those CalWorks programs. There was no way to connect the families to those resources. And vice versa, our eligibility staff who were involved with those CalWorks programs have no way of being able to know if their families are working with or involved with child welfare. So we had this big, huge disconnect. Another issue that we ran into was all of our programs are contracted out with community-based organizations to provide our services, but our partners were limited by some of the rules and some of their policies and procedures they had to follow. And ultimately what that turned into was delays in getting our families into services. We're talking about months from the time one of our workers would submit a referral to the time our contractor was able to actually enroll the family and start doing services. When we're talking about preventive services for our families and child welfare, timing is everything. So we got to make sure that we have a system in place where we can get to these things quickly before they escalate to something more drastic. So that's where our housing support unit comes into play. We centralize access to all of our housing programs. So now both our internal and external partners have one source that they can go to reach out for any housing or homelessness assistance that they may need. We also streamlined our referral process. We got rid of all the other stuff that we thought just wasn't necessary, and we streamlined it down to one referral form. And to refer a family to us, there's actually no forms required. Our internal and external partners can reach out to us through a variety of different ways. They can email us, they can call us, they can go onto our public-facing webpage, and they can actually complete a contact form on that webpage that will automatically come directly to us. As soon as we get that information, we're calling the families, and we're starting that process there. We also established an internal screening system so that when we're talking with our families, we're not just looking at that one program that they may have called us about. We're looking at all the programs across the board. And we're trying to see, okay, based on your unique situation, what's going on with you and your family at this moment, do you qualify for any other program that can probably be more beneficial for you? And let's get you connected with that one. And then we started using data to help drive us and try to find out where can we improve our service delivery model. So we use weekly data reports that we're pulling from our databases to try to find what are those other families and other individuals out there within our community that are coming into our building, coming through our front doors, telling us that they're homeless or they're at risk, and that we can try to connect them with services. And then finally, we built a strong relationship with the coordinated entry system. We now have the ability to complete the necessary assessments and enroll families and individuals directly into the coordinated entry system, all through DHS right here. So it's become a one-stop shop, and that's what we're really excited about. Next slide. As far as our procedures go, some of that streamlining process that we've done. At initial contact, everyone who calls us will complete an assessment of barriers and vulnerabilities to determine a priority score. And the whole reason for that is we want to make sure that those families and individuals who are in the most need are getting the services quickly as possible. So we're doing that at the very first phone call. So we already know kind of what's going on in their situation. Then we submit the information to a housing coordinator. And when they're talking with the housing coordinator, we're getting a little bit more depth and we're getting a little bit more details into their situation. Primarily what we're doing here is we're looking to see, based on the family situation, are we falling into HUD's definitions of either homeless or at risk of homelessness? And the reason why that's so critical is because all of our partner agencies and all the other community-based organizations within the coordinated entry system follow HUD's rules. So if we can align to that, we're just streamlining that process. We're already telling everybody that this family meets HUD's criteria for this level. It speeds up the whole process there. And then once we refer a family out to a contracted service provider or to another community-based organization, our coordinators are going to continue following up with them to make sure, hey, we sent you this referral. What have you done with it, right? Make sure they're not sitting on it for too long. Make sure they're getting to the service timely. And we're also following back up with the families. How are things going? Are you working well with the contractor? Are they giving you what you need? Are there any issues on there? And the reason why this is so important is because then we're able to go back to our staff. We're able to go back to child welfare, to our social workers. We can go back to our other partner agencies who've been in contact with us, and we can let them know, hey, this is where your family is at today. So you're able to get all that information quickly, because once again, when we're looking at it from that preventive lens, timing is everything. So the sooner and quicker we can get to the services, the better. Next slide. So this is a list of some of the housing programs that are available through Department of Human Services. And I apologize for some of those that are blue. It's kind of hard to see. Those are our CalWorks programs there. What I want to show here on this screen is this is just some of the programs that are available. Now, not all of these are being managed by the Housing Support Unit, but we've educated ourselves into every single one of these programs so that we know what the core service eligibility requirements are. So as we're talking with families and individuals, these are all the different programs that we're trying to match them to. And so we're looking at it from, that housing first perspective, that can we screen you in to anything else that's going to help you out? Can we braid different programs together? Can we combine different programs together to help you out? Because once again, timing is everything. We don't want their situation to escalate any further. The next slide. So the next couple slides here, I want to talk about two of the main child welfare programs that we have in-house when it comes to housing and homelessness assistance. The first one is our Bringing Families Home program. This is a CDSS funded program. It is a wonderful and amazing program. It is the only program that we have in-house that is providing the necessary housing related supports to our child welfare families. It's very, very critical. The reason why I'm sharing that is because if you guys are paying attention to the governor's proposals here for his budgets, there's been severe cuts to this program. So we're really, really hoping we can advocate for this program. Let the state know how important it is. Very, very important. The beautiful thing about this program, with an addition of the housing support unit, is not only are we getting families into this program sooner and faster, but it's that fact that we can now become that mediator between our families and their CPS workers. We can mediate those conversations. We can communicate the needs of both the social workers regarding compliance to case plans and the family in regards to what's going on with theirs. So we're active with the child family team meetings where we go into them. We let them know, hey, this is where they're as far as housing goes. Here's some other obstacles that we can see, and we try to identify what else, other supports that we can provide. Next slide. This next one here is the Family Unification Program. This is a contract that we have with the Housing Authority of Kern County, where the Housing Authority can provide housing choice vouchers to families and foster youth who are participating in child welfare. Now, historically, prior to our housing support unit coming into play, this program was really managed by one of our partner agencies, and it was primarily utilized for our foster youth, which is awesome. They need it. This is a beautiful program for our foster youth. But there is another component to it, and that is our families who are trying to reunify, but their lack of adequate housing is causing a delay in that. This is where we came into play, as we started saying, hey, let's identify more of our child welfare families who have that inadequate housing, who cannot afford the housing that's currently available, where that's delaying their family from being able to reunify, and let's use this program. So we're starting to get more involved in this. And as of today, we've already identified 4 families who have been eligible for this program. And I think we just got our 3rd approval. So we're starting to get more families into these housing choice vouchers. And another thing that's pretty amazing about this regarding the housing choice vouchers, for foster youth, the vouchers are only good for 3 years. After 3 years, they lose it. It goes back into the system. Our family ones are forever vouchers. So if we can get our families into these vouchers, they have this voucher forever. And when we're talking about preventative services, what better way to prevent reoccurring back into the child welfare system than making sure that they have safe, stable housing? So this is a very, very good program that we're starting to become more involved in. Next slide. Then we started noticing some things. We started noticing there's a big gap in services, especially when we were looking at from that preventative lens. When we were looking at our families who are CalWORKs eligible, it seems that through CalWORKs, they have almost an abundance of resources at every step of the way. But when we're talking about our child welfare families, we started noticing a big gap. And the big gap happened to be from the time they come into our doors and they tell us that they're homeless to the time we're able to get them into a program to identify permanent stable housing. There's nothing for them in between. So we started looking at, okay, where are these families going for help? And we noticed that a lot of our families, when they can't, or when it's determined that they're not going to escalate up to a family reunification case, maybe it's that's not going to be taken any further. It's going to get evaluated out to one of our partner agencies through differential response. So we contacted differential response. So, hey, what are you guys doing? What are you providing? And the information we got back is, well, for those folks who are homeless or they're facing eviction, we're having to use our own general funds to pay for this, and we don't have any other supports to go with it. So we knew, okay, we got to do something about this. We know we have the ability, we can do some more help. So that's when we start looking at, can we do something that's going to help us meet that primary universal level of the preventative care to ensure that our families are going to be safe and stable while they're navigating down their path. And that's where we came up with this good idea. We can go to the next slide. We've introduced a new program known as our Child Welfare Emergency Supports Program. This is an immediate needs program where once we identify a family involved in child welfare that needs those immediate needs services, they need temporary shelter, they need rental arrears to help them prevent an instance of eviction. And in addition to another big thing that we noticed too is when it comes to utility arrear payments. You know, if we have a family that's housed, but they're behind on PG&E, they're going to get their electricity cut out. That's not going to help their situation, especially when we're talking about preventative measures. And then we also noticed that, you know, for a lot of our families who are escaping domestic violence or victims of domestic violence, once again, if they're CalWORKs aided, abundance of resources. Our parents who are not CalWORKs aided, not much there for them. So we say, we got to do something about this. So we established this new program so that through our housing support unit, we can provide up to 16 days of hotel stay. If a parent is a victim of domestic violence and fleeing domestic violence, we can raise that up to 32 days of temporary hotel stay as we're trying to help them navigate to a safety shelter. We can provide up to 3 months of rental arrears and 3 months of utility arrears to prevent an instance of eviction. The whole idea, once again, coming with that preventive lens, we want to make sure that the family is safe and stable in their housing so that they can focus on the other concerns at hand to make sure that everybody in the home is going to be safe. Go to the next slide. Oh, another one. Sorry about this, about the color of the text here. I'll try to read it the best I can. But wanted to give you some information to kind of show you how we're able to make some of these changes and how well they came across. So when we take a look how things were being handled back in state fiscal year 21-22, and we compare it to 22-23, we saw a ginormous increase in the amount of referrals going into bringing families home, but also to, most importantly, how many of our bringing families home families were becoming permanently housed. We saw a 62% increase in the amount of referrals being enrolled. That was 62% more families getting enrolled into the program and getting the services they need. We had a 176% increase in the number of families being permanently housed and bringing families home. In the whole fiscal year 21-22, they only housed 17 families. The moment housing support came in, we were able to bump that up to 47 families in 1 year. We were able to find permanent housing. In regards to our emergency support program, we implemented this in last October 2023. Since then, we've approved over 19 temporary shelter stays, and we've approved 9 arrears. You can see some of the amounts of funds that we expense there. But there's more behind the stats, and there's a couple of success stories that I wanted to share to really drive home how these resources are really helping with that preventative lens. We had a parent who was in family reunification at the time. The parent was living in a sober living home. Now, unfortunately, since she was living in the sober living home, she doesn't qualify as being homeless or at risk of homeless through HUD standards. So when we were trying to get this parent involved with some of the other programs, we kept getting denials. They said, no, they have to wait until they are exited out of the sober living home and they're actually homeless before we can help them. That doesn't make sense to us. We're like, no, we can't be doing this. And then something amazing happened. During this time, the mom was able to get reunified with her family. But then we have a problem. They're staying at a sober living home. They can't accept all the kids. What's going to happen? Social worker and child welfare came to us and said, can you guys offer any help? And our light bulb came on. Our emergency supports, that's why we created this. So we were able to use our emergency supports to help this parent get temporary shelter where they were able to get a motel room with her and all her children, be able to stay together in one spot. And then because she got her children reunified, we were able to get her back onto CalWORKs again. And then through CalWORKs, we got her paired up with our CalWORKs housing support program. She's out there finding supportive permanent housing as we speak. So that's looking at really, really promising there. We have one more I wanted to share. This one was another unique situation. We got a phone call from another county called us and said, hey, we have a parent that's in our bringing families home over at this other county, but they moved to Kern County. Like, oh, okay, that's awesome. Why did they move to Kern County? Well, their support network is here. They're all by themselves in this other county, but they have family in Kern County. Can you guys help them? Yes, we can. So we took that referral. We accepted that inter-county transfer. We started talking to the parent. We're like, well, where are you staying at? Well, I'm living in my car. Well, why are you living in your car? We thought you came here with family. And then she told us, well, I have family here, but they have no room for me. Okay, how can we help? There we go again. That gap in services one more time, right? We utilize our emergency support program. We're able to put her into temporary shelter. While she was in temporary shelter, we got her enrolled into our Bringing Families program here in Kern County. And then I followed up on this case this morning. The unit that she found is going through inspection today. So hopefully she'll be moving in this week. So that's what I have regarding our housing support unit and some of the things that we've done to help with preventative measures. So hopefully that's good information there. And if I have any questions, I'll be happy to help answer them.
Thank you all so much. I know we're just a little bit over. I'll hand it off to Michael if we have anything. And obviously, if you guys have any questions, you can direct them over via chat or email, and I'm sure the organizers will pass those along since we don't have a chance to get to them. But thank you guys all so much for being a part of our presentation.
Yeah, no, all I have is what I put in the chat to get into the main session. You leave this one and you go back to the browser window that had the lobby and find the main session and click in. But thank you all. This is such great information, amazing programs, and I wish you the best.
Thank you.
Thank you.
Thank you.
I'm probably going to reach out on behalf of the California Family Resource Association. Just want to learn more, and you just give such a great message on FRCs too. So we'll be in touch.